Welcome to the Deep Dive. Today, we're going to be looking at, we're diving into a case from JAVMA about a golden retriever that developed neurological signs after being treated for what seemed like pretty routine GI problems.
Yeah, this case is a really great example of just how crucial that electrolyte balance can be, especially in, a neurological context.
Yeah. So this 3-year-old golden retriever initially presented with vomiting, diarrhea, decreased appetite, like the classic signs of GI distress. Initial blood work revealed hypoproteinemia at 38 GL, the reference range being 50 to 70. Severe hyponatremia at 119 millimole, reference range 142 to 152, and hyperbilirubinemia at 120.3 logML, with a reference range of 0 to 7. There was also mildly increased urea at 14.9 millimole, with a reference range of 2.8 to 8.3.
Right. And so based on those findings, the dog was diagnosed with gastrointestinal disease and hepatopathy. And I think the severe hyponatremia is going to be particularly important as we see as we get through this case.
Right. So the dog was treated with IV fluids, initially improved enough to be discharged, but then just 2 days later, the dog started showing some pretty concerning neurological symptoms.
Yeah. Started exhibiting some abnormal behavior, including agitation and disorientation, along with an intermittent pacing gait. There was also mild ataxia in all 4 limbs, dysmetria, titubation, and head tremors.
And these symptoms continued to worsen over the next 48 hours.
That's right. So the dog developed generalized tremors, severe ataxia with marked hypermetria, truncal titubation, wide head excursions, reduced menace response in the right eye, and delayed proprioception in all 4 limbs.
Wow. That's quite a decline. Did the neurological exam provide any more specific insights?
So the neurological exam findings were detailed in Table 1 of this case report, but, it showed several key abnormalities. So the dog had a dull mentation, abnormal posture with kind of a wide-based stance. Cranial nerve examination showed a decreased menace response on the right side, indicating there could be an issue with the optic nerve or the, processing centers in the brain.
So based on these signs, where were the vets suspecting the problem was localized?
So based on these clinical signs, the most likely anatomical locations were going to be the cerebellum, which plays a really important role in motor control and coordination, the brainstem, which controls many vital functions, and then, potentially the forebrain, which is responsible for the higher level cognitive functions.
So with such a diverse range of potential areas affected, the differential diagnosis list must have been pretty extensive.
Yeah. So the initial differential diagnoses included infectious diseases such as protozoal, viral, fungal, and bacterial infections, also inflammatory diseases like meningoencephalitis. And then there was, quite a few metabolic processes that were on the list: thiamine deficiency, hyperammonemia, hyperbilirubinemia, and importantly, osmotic demyelination syndrome. And then degenerative or neoplastic processes were considered but deemed less likely given the dog's age and, that rapid progression of the symptoms.
So given the dog's history of GI issues and electrolyte imbalances, it seems like the vets were particularly suspicious of a metabolic cause.
Exactly. That history of severe hyponatremia followed by its rapid correction really raised red flags.
So what did they do to investigate these possibilities?
So they performed a very thorough diagnostic workup, including repeat blood work, hematology, biochemistry, electrolytes, ammonia levels, bile acid stimulation test, ACTH stimulation test. They also did a urinalysis, measured the dog's blood pressure, and obtained an MRI of the brain and a CSF analysis.
That's quite a workup. Did any of those tests provide any additional clues?
Yeah. So it's interesting. The further blood work didn't actually reveal any continuing metabolic abnormalities, but the MRI findings were pretty revealing.
What did the MRI show?
So the MRI revealed bilateral symmetrical areas of increased signal intensity on T2 MLIR and T2 star-weighted images in the thalamus and the lentiform nuclei. There was no contrast enhancement observed, and there was also subjectively diffuse increased signal intensity in the cerebellum on T2-weighted sagittal images.
So those findings, combined with the dog's history, pointed the vets towards a specific diagnosis.
They did. All those MRI findings, in conjunction with that history of the rapid correction of the severe hyponatremia, really strongly suggested a diagnosis of osmotic demyelination syndrome, or ODS.
ODS. That sounds serious. What exactly is it?
Osmotic demyelination syndrome is a condition it's characterized by damage to the myelin sheath, the protective covering that surrounds nerve fibers in the brain. And in this case, the rapid correction of that dog's chronic hyponatremia that likely triggered this whole syndrome.
So the very treatment that was meant to help the dog may have inadvertently caused this serious complication.
Yeah, unfortunately, that appears to be the case. So that, rapid influx of sodium into the brain cells after they've kind of adapted to these low sodium levels, that can disrupt the osmotic balance, leading to myelin damage.
So how does that process actually unfold? What's happening at that cellular level?
So when sodium levels are chronically low, the brain cells, they kind of adapt. They reduce their intracellular osmolyte concentration to maintain that osmotic balance. And that adaptation, helps prevent excessive water from flowing into the cells, right? But when sodium levels are then corrected rapidly, there's a lag in that reuptake of these osmolytes. So, that means that as the sodium levels are rising in that extracellular fluid, water is rapidly shifting out of the brain cells, causing them to shrink.
And this rapid shrinkage is what damages that myelin.
Exactly. The myelin sheath, which is composed of lipids and proteins, it's particularly vulnerable to these rapid osmotic shifts. The shrinkage can cause the myelin to detach from the nerve fibers, leading to the formation of vacuoles and ultimately demyelination. And, in severe cases, the myelin sheath can even rupture.
So it sounds like this damage isn't limited to the myelin itself. Are there other cells that are affected?
You're right. So it's not just the myelin. The osmotic stress can also trigger what we call apoptosis, which is programmed cell death, in astrocytes. And astrocytes are really important. They're the support cells in the brain. They play a really vital role in maintaining the blood-brain barrier and regulating the extracellular environment. So their loss can further disrupt brain function and worsen the damage.
So it's like this cascade of negative events set off by that initial rapid sodium correction. Now, this case specifically mentioned extrapontine myelinolysis. Can you explain what that is?
Sure. So extrapontine myelinolysis is a form of ODS that affects areas of the brain outside the pons, which is part of the brainstem. And so, in humans, ODS is often categorized as either central pontine myelinolysis, which primarily affects the pons, or extrapontine myelinolysis, which, as the name suggests, involves other brain regions like the thalamus, the basal ganglia, and the cerebellum, as we saw in this golden retriever.
And these are all areas that are involved in motor control, which explains the dog's severe ataxia and other neurological symptoms. So it's like a domino effect, one imbalance triggering another, leading to widespread damage. How common is ODS in dogs?
That's a great question. While ODS is relatively rare in veterinary medicine, it's thought to be underdiagnosed because it can be challenging to recognize. So ODS should always be on that differential list for any dog presenting with acute neurological signs following rapid correction of hyponatremia.
Now, this case mentioned that neurological signs typically appear 2 to 6 days after sodium correction. Is that consistent with what you see in dogs?
Yeah, that time frame is consistent with the typical onset of those neurological signs that we see in dogs with ODS. And early recognition is, really critical for prompt intervention.
So what is the prognosis for dogs that develop ODS? Is it always as severe as what this golden retriever experienced?
Well, the prognosis for dogs with ODS can vary widely, depending on the severity of the myelin damage and the areas of the brain that are affected. Some dogs may only exhibit, mild and transient neurological signs, while others might experience more severe and persistent deficits. So historically, ODS was considered to have a very grave prognosis, particularly in humans. But more recent studies suggest a more favorable outcome. Over 50% of human cases are showing improvement. And encouragingly, all dogs in recent case reports have recovered neurological function within 1 to 4 weeks, which really highlights the resilience of that canine nervous system.
That's reassuring to hear. What about this particular golden retriever? What was the outcome for this dog?
So this dog's outcome was actually quite positive. Despite the severity of those initial neurological signs, it received only supportive care and was discharged after 5 days. And remarkably, within 2 months, the dog had made a near-complete recovery, with only mild residual ataxia and hypermetria.
That's great. It really emphasizes the importance of early diagnosis and appropriate management, but it also raises another really crucial question. How can we prevent this from happening in the first place? How do we ensure that we are correcting these electrolyte imbalances safely? So we've been talking about this fascinating case of ODS and a golden retriever, and it really highlights the potential for complications, even when we're, trying to do the right thing. What can vets do to prevent ODS from happening in the first place?
Yeah. That's the burning question, isn't it? So the key to preventing ODS is really careful management of those electrolyte imbalances, particularly hyponatremia. And prevention starts with identifying at-risk patients, those with conditions like gastrointestinal disease, liver disease, anything that can disrupt that sodium balance. Early detection is crucial.
Yeah, early detection makes sense, right? So you have more time to correct things gradually.
Precisely. And then when correcting hyponatremia, slow and steady wins the race, right? The goal is to raise those sodium levels gradually, avoiding those rapid shifts that we've seen can be so detrimental.
So no more like IV fluid blitzes.
Not when it comes to correcting hyponatremia. We've got to find that sweet spot, correcting the imbalance without overwhelming the system. And it requires vigilance, right? Frequent monitoring of those sodium levels and adjusting fluid therapy accordingly. It's all about that measured and cautious approach.
What's the safe rate of correction we should be aiming for?
So the generally accepted recommendation is to increase sodium levels by no more than 0.5 millimole per hour or 10 to 12 millimole per day. And, we also want to make sure that we're not overcorrecting, as that can lead to its own set of problems like hypernatremia. It's a delicate balancing act.
But even with the best intentions and careful monitoring, complications can still happen. So what if a dog does develop ODS? What are the treatment options at that point?
Well, unfortunately, there's no specific cure for ODS. Treatment primarily focuses on managing those neurological symptoms and providing supportive care to prevent further complications. And this includes addressing any seizures, ensuring adequate nutritional support, and, just creating a safe and comfortable environment for the patient.
Are there any medications that might be helpful?
There's some emerging evidence that suggests potential benefits of certain medications, like myo-inositol and thiamine. But more research is definitely needed to confirm their efficacy in treating ODS.
So early intervention is really key, both in terms of preventing ODS, but also managing its effects should it occur.
Absolutely. The sooner you recognize those signs and intervene, the better the chances of minimizing the long-term impact on the dog's neurological function.
Now, this golden retriever experienced quite a severe decline. Can we assume there's a spectrum of ODS severity, with some dogs experiencing milder symptoms?
That's a great point. ODS presentation can vary. It can range from mild ataxia or subtle behavioral changes to more severe things like paralysis or seizures. And it really all depends on the extent of that myelin damage and which brain areas are affected.
So what red flags should vets be watching for, especially in dogs with a history of these electrolyte imbalances?
Any acute onset of neurological signs following rapid correction of hyponatremia, that should be a huge red flag. So vets need to pay close attention to any changes in mentation, gait abnormalities, tremors, or any cranial nerve deficits. Early recognition is, it's paramount.
What about diagnostic imaging? Does the MRI always show those characteristic lesions right away?
Not always. Sometimes those characteristic changes, they might not show up immediately on that initial MRI. So repeating the scan later on, what we call serial MRI imaging, can be really helpful in confirming the diagnosis and monitoring the progression of the disease.
This case really highlights how interconnected different body systems are. How something starting as a seemingly routine GI issue can spiral into this complex neurological problem.
It does. It underscores the need for that holistic approach in veterinary medicine. We need to consider all the potential ramifications of our interventions and always strive to minimize those risks. This case serves as a really powerful reminder of the importance of careful monitoring, gradual correction of those electrolyte imbalances, and really understanding the potential complications.
And ODS isn't just something that we see in dogs, right? I understand it's recognized in human medicine as well.
You're absolutely right. ODS can occur in humans too. We often see it in individuals who are recovering from, things like severe malnutrition, alcoholism, or those who have undergone certain medical procedures that disrupt that sodium balance.
So the underlying mechanism, that rapid correction of hyponatremia, it's essentially the same.
Yeah, that mechanism is very similar. Prolonged low sodium, it leads to those cellular adaptations. And then when those sodium levels are rapidly corrected, it creates that osmotic imbalance, right? Which then damages the myelin and sets off that cascade of neurological consequences.
And I imagine, just like in dogs, the symptoms and severity in humans, it can vary depending on which parts of the brain are affected.
Yeah.
Now, is the prognosis generally the same in both species?
Yeah, that's the crux of the matter. While we see a wide range of outcomes in both dogs and humans, historically, ODS has been associated with a higher mortality rate in humans. This was particularly true, in the past when our understanding and management of these electrolyte imbalances was less advanced. But thankfully, things are improving.
That's good to hear. So we're seeing better outcomes for those human patients now.
Yeah. With advances in critical care and a greater awareness of those risks associated with rapid sodium correction, we're seeing improved outcomes in human patients as well. Prompt diagnosis, supportive care, and in some cases, some more targeted therapies are enabling many individuals with ODS to experience, significant recovery, even if some of those neurological deficits might persist.
Sounds like there's a lot that we can learn from each other, both in human and in veterinary medicine.
Absolutely. This continuous exchange of knowledge and insights, it benefits both our animal companions and ourselves. And this golden retriever's case, it serves as a really powerful reminder for veterinarians and physicians alike to approach those electrolyte imbalances cautiously and to always be mindful of those potential complications.
This deep dive has been incredibly informative. It's really shed light on this, complex condition that might not always be top of mind. What are your final thoughts for our listeners today?
Respect that delicate balance of electrolytes in the body. While correcting imbalances is absolutely crucial, it's equally vital to do so gradually and with that careful monitoring. Rushing the process can have those unintended consequences, as we've seen with ODS.
From Vet NeuroJar, keep those minds inspired, hearts light, and tails wagging.